Across the Caribbean, thousands of patients rely on Cuban doctors. In some countries, these doctors are not just helping the healthcare system, they are holding it together. Now the Caribbean governments are facing pressure to send those doctors home. If that happens, hospitals across the region could face a serious health crisis. If you want clear analysis about Africa, Caribbean, and the global power shifts, subscribe to the West Best Media right now. For decades, Cuba has trained thousands of doctors and sent them across the world. Medical mission from Cuba operates in Africa, Latin America, and throughout the Caribbean. In fact, Cuba has one of the highest doctors to population ratio in the world. Because of that, Cuban doctors have become a lifeline for many developed nations. In the Caribbean, they work in rural clinics, small hospitals, emergency units, the public health care facilities where local systems struggle to recruit medical professionals. In many communities, they are often the only doctors available. If Cuban doctors are working in your country or have worked in your community, leave a comment below and tell us what you have seen. The reality is that many Caribbean nations face a serious shortage of doctors. Training a physician takes many years and significant investment. At the same time, wealthier countries like the United States, Canada, and the United Kingdom actively recruit medical professions from the Caribbean. This creates a problem known as brain drain. Doctors trained in the Caribbean countries often move abroad for higher salaries and better opportunity. That leaves the hospitals and clinics back home struggling to fill positions. For many governments, Cuban medical missions have helped fill that gap. If you think this issue deserves more attention, hit the like button so more people can see this video. The United States argue that Cuba medical missions are not simply humanitarian programs. Washington claimed Cuban government earned significant revenue from the program and that the doctors operate under restrictive conditions. Because of those concerns, American policy has increasingly targeted countries that participate in Cuban medical mission. Some Caribbean governments are now being encouraged to reconsider these partnerships. This creates difficulties, political situation for a small island state that rely heavily on those doctors. There's also a contradiction that many observers point out. The United States strongly oppose Cuba's political system and maintain sanctions against the island. Yet at the same time, the United States trade extensively with China, another communist country. China is actually one of America's largest trading partners. This raises a question many people ask. If ideology is issued by why Cuba is treated different when Caribbean healthcare system depend on these doctors. What do you think about this situation? Should Caribbean nation keep Cuban doctors or should they send them back home? Share your thoughts in the comment. If Cuban doctors were suddenly removed from Caribbean healthcare system, the effect could be immediate. Hospital could hospital could face staff shortage. Clinics in rural area might close. Waiting time for medical treatment could increase. And small islands that already struggle with limited healthcare resource could face a serious pressure. For government across the region, the decision isn't that simple. It's directly affect the healthcare system. The story of Cuban doctors in the Caribbean is not about medicine. It is about geopolitical international pressure and difficult choices some small nation must make when powerful countries influence regional policy. The decision made is in the coming years could shape the future of the healthcare across the Caribbean. If you want more direct discussion about Africa, Caribbean, and global politics, how global politics shift, subscribe to West Best Media and stay informed.